South Africans will be watching President Cyril Ramphosa tonight to see if there will be any relaxing of COVID-19 lockdown restrictions. The decision on whether to revise the regulations will obviously be based on the number of infections in the country, as well as people who succumbed in the count of COVID-19 related deaths and pressure on health facilities. Let's have a weekly conversation now with Dr. Ridhwaan Suliman, who's been keeping a close eye on the daily data. Doctor, always great to have you on Newsfeed PM. Let's begin with Gauteng. The numbers are down significantly from when you and I last spoke 2 weeks ago. Is the province officially out of the danger zone?
Good afternoon, Thembekile. The situation in Gauteng is certainly looking a lot more promising right now than it has been for the previous few weeks, with all indicators now on a downward trend, including the number of cases, the new hospital admissions, as well as the number of reported deaths. So certainly Gauteng has passed the peak of its third wave. However, I don't think that we're completely out of the woods just yet. We do need to remain vigilant and can't become complacent, because remember, a peak means the highest point, and we still need to really go down to much lower levels where the risk is much better. So the number of cases in Gauteng currently just over 4,100 new cases being reported over the past week, down 40% week on week, and down to about 35% of the peak that the province saw about 3 weeks ago. New hospital admissions are also showing a decline now, down 17% week on week, and deaths too in Gauteng are starting to show a decline, down about 14% week on week. So it's looking promising, but we can't become complacent just yet.
I was also looking at the gap between daily infections reported by Gauteng and the Western Cape. It appears to be closing. Just last night, the Western Cape recorded over 2,000 new cases. Is that likely to be the next epicenter?
Yes, so at the moment, Western Cape is recording the highest number of infections in the country, and it seems to have slowed down over the past couple of weeks, but still increasing ever so slightly. So the number of new cases in Western Cape are up 6% week on week. So on this sort of stubborn plateau at the moment, hopefully we'll see that peak and start to actually turn around soon. But yes, Western Cape now is reporting the most number of cases in the country per 100,000 population. So something to certainly consider. The hospitalizations in Western Cape, we know that hospital admissions do lag, and they are still increasing in the Western Cape, up by about 15 to 20% in that province.
And nationally, 455 people currently in hospital now, and one sort of wants to phrase this in a way that's not vulgar. The worrying thing with the high admissions rate in hospitals or hospitalizations is that it reflects in the number of people who die, sadly.
Yeah, unfortunately, we know that admissions lag the case indicator, and unfortunately is a precursor to indicate the number of deaths that we're likely to see. Nationally, though, we're starting to see a slight decline in the number of new hospital admissions, just about 13,000 new hospital admissions in the previous week, down 7% week on week, primarily driven again by that decrease in new admissions in Gauteng. We're still seeing a rise in new hospital admissions in the Western Cape, in the Eastern Cape, and a slight rise still in Mpumalanga.
Make mathematical sense of this for us. The test positivity rate, we're seeing fewer people testing positive, but the test positivity rate is still much higher than what the World Health Organization says is an acceptable test positivity rate, because I think it's supposed to be around 5% to be at a healthy level, right?
That's quite correct. So remember that the test positivity rate is a function of the number of positive tests or new cases reported in proportion to total tests that we are conducting. So while the number of tests that we are doing is on a decline, over the last week it's declined by about 9% to about 46,000 new tests per day nationally. The rate of confirmed cases or positive tests coming back is declined even further. So the rate nationally has declined by about 20% week on week, and therefore the test positivity rate is showing an overall decline, down 11% week on week, which is good. It means that even though less people are presenting for testing, it's an indication that there are probably less infections and therefore less people showing symptoms, and the fact that the rate of decline of infections overrides the rate of decline of tests is represented in that test positivity rate. It is still high at an average of 26% nationally, meaning 1 in every 4 tests is returning a positive result. But I think the hopeful news is that it is on a downward trend now as well.
And we touched on deaths a short time ago, but those, last night we recorded about 450 according to the NICD, COVID-19 related deaths. Are we likely to see that trend precisely because of the lag between infection and hospitalization, and sadly for those who succumb? Are we likely to see this for a few more weeks or days?
Unfortunately, because of that lag, we're likely to still see the number of reported deaths increase. We're starting to see a decline in new hospital admissions now, and we know deaths do lag by about a week to 2. So hopefully following the decline in admissions, we'll start to see a decline in new deaths being reported. On average, we still reported over 400 new deaths per day nationally over the past week, and that's increased by about 11%. I think we also need to take into account that reported deaths, in terms of the reporting, is delayed as well. So likely we'll still see a backlog of deaths being reported, unfortunately, which means the impact of this third wave will still take a while to actually see the true burden in the deaths.
Dr. Ridhwaan Suliman from the CSIR, always good to speak to you. Thank you so much for your analysis of the latest data on COVID-19 in South Africa.
Thanks for having me.